Aspirin, also known as acetylsalicylic acid, is one of the most widely used and well-studied drugs in medicine. Its effects vary remarkably with the dose administered, owing to its dose-dependent inhibition of the cyclooxygenase (COX) enzymes, which regulate the synthesis of prostaglandins and thromboxane A2. These biochemical mediators played distinct roles in inflammation, pain, fever, and platelet aggregation. Hence, different doses of aspirin produce distinct therapeutic and pharmacological outcomes. To remember these effects easily, the following mnemonics are helpful. At low dose, low clot. At medium dose, moderate pain and temperature gone. At high dose, heat, pain, and swelling down, and too high dose are too harmful. At low doses, 75 to 100 mg per day, aspirin primarily acts as an antiplatelet or cardioprotective agent. This effect occurs due to the irreversible inhibition of the COX-1 enzyme in platelets, which leads to a decrease in thromboxane A2 formation, a potent promoter of platelet aggregation and vasoconstriction. Importantly, endothelial prostacyclin, PGI2, which has opposing effects such as vasodilation and inhibition of platelet aggregation, is less affected at this dose. Thus, low-dose aspirin selectively suppresses platelet activity, reducing the risk of thrombus formation. Clinically, it is widely used for myocardial infarction, MI prevention, stroke prophylaxis, and in patients after angioplasty or coronary artery bypass graft surgery. This effect can be recalled by the mnemonic at low dose, low clot. At intermediate doses, 300 to 600 mg every 4 to 6 hours, aspirin exhibits analgesic and antipyretic properties. At this dose range, it inhibits both COX-1 and COX-2 enzymes in peripheral tissues and in the hypothalamus. The reduction in prostaglandin synthesis at the site of inflammation diminishes the sensitization of nociceptors to pain mediators, providing relief in mild to moderate pain such as headache, myalgia, and arthralgia. In the hypothalamus, decreased PGE2 production helps lower the set point of body temperature, resulting in an antipyretic effect. Therefore, this dose is typically used for pain, fever, and inflammatory conditions, remembered by the mnemonic at medium dose, moderate pain and temperature gone. At high doses, 900 to 1800 mg every 4 to 6 hours, aspirin shows a strong anti-inflammatory effect, making it beneficial in conditions such as rheumatoid arthritis, osteoarthritis, and acute rheumatic fever. The higher dose causes a more pronounced inhibition of COX-2-mediated prostaglandin synthesis, leading to reduced vasodilation, edema, and leukocyte infiltration, hallmarks of inflammation. However, at these doses, the risk of gastric irritation, bleeding, and renal impairment increases significantly. This can be remembered with the mnemonic at high dose, heat, pain, and swelling down. At very high or toxic doses, more than 6 g per day, aspirin loses its therapeutic selectivity and causes systemic toxicity known as salicylism. This condition is characterized by tinnitus, dizziness, nausea, vomiting, and hearing loss, progressing to hyperventilation, respiratory alkalosis, metabolic acidosis, and even coma in severe poisoning. The toxicity results from aspirin's interference with oxidative phosphorylation and acid-base balance. Therefore, doses above the therapeutic range should be avoided, and such cases require immediate medical attention. The mnemonic, too high doses are too harmful, summarize this toxic level. In summary, aspirin's pharmacological actions are dose-dependent, transitioning from antiplatelet effects at low doses to analgesic, antipyretic, and anti-inflammatory effects at progressively higher doses, and finally to toxic manifestations at excessive intake. Understanding this dose-wise effect is clinically important to optimize its therapeutic benefits while minimizing adverse outcomes. Careful patient selection, monitoring, and awareness of contraindications, such as peptic ulcer disease, bleeding disorders, and viral infections in children, due to the risk of Reyes syndrome, are essential for the safe and effective use of aspirin.